going to welcome Kevin Finn, who is the Dean of the School of Nursing and Health Sciences at Colby Sawyer College. Kevin started this past year, and I'll tell you a little bit about him, give you a little bit of background about the nursing program at Colby Sawyer. If you have been around a long time, Mary Hitchcock Memorial Hospital closed its School of Nursing back in 1980. And in the 1980s, Colby Sawyer began a nursing program. And then it continued on with some affiliation with Mary Hitchcock Memorial Hospital. But in 2007, Sue Reeves basically turned the program around and really enhanced it dramatically in the 10 or so years that she led the nursing program. She enhanced that affiliation with Dartmouth Hitchcock, great success with the pass rate for nurses graduating from the program, nearly 100% on their exams as they got their licenses, added a master's program. Faculty at DH are the people, the faculty include people at DH. So the program has taken off and has done very, very well. In 2017, Sue left and went to Dartmouth Hitchcock, and she's now an executive vice president and the chief nursing executive at DH. In January of 2020, Colby Sawyer and DH announced an enhanced affiliation agreement that Kevin will tell you about. And that's part of the reason that he's here. I think we all should be interested in hearing some of the collaboration that's taking place between Colby Sawyer and Dartmouth Hitchcock. Kevin went to Merrimack College, got a master's at Fairfield University and a PhD at Boston University. And then he spent 10 or so years at Merrimack as an assistant professor, an associate professor, then a professor, department chair, eventually one of the associate deans, and then came to Colby Sawyer, where he's responsible for the new program development and program changes that align with Colby Sawyer's strategic plan, its commitment to liberal education, and its enhanced partnership with Dartmouth Hitchcock. He also has at Dartmouth Hitchcock a position as the director of clinical partnership between Colby Sawyer and DH. And in that capacity, he works on enhancing curricular opportunities, student internships, employment opportunities for Colby Sawyer graduates. But he also works closely with the Dartmouth Hitchcock workforce development team to establish career pathways and to provide enhanced ability for the workforce at DH to stay in the Upper Valley. So that's my introduction, and I'll turn it over to Kevin, who I believe has a PowerPoint that he'll present, and he can tell you more about the relationship between Colby Sawyer and DH.
Thanks, Tom, for the introduction, and thanks for inviting me today, everyone. And looking forward to providing you some updates on, as Tom articulated, the partnership between Dartmouth Hitchcock Health and Colby Sawyer. And so what I wanted to kind of go through today was a little bit of my background, kind of where I come from, and Tom kind of hit some highlights, and I'll go through those rather quickly since he did a nice job with that. And really mainly talk about today just the shift, as Tom articulated, that Colby Sawyer is focused on nursing and health sciences, and how the Dartmouth Hitchcock Health partnerships are a really big part of that, and how the purpose of that partnership and what it means for the Upper Valley and the workforce development work. So, and would love to have some questions at the end, or for folks if there's anything that comes up. So let's get started. So as Tom said, I have a background from Merrimack College in sports medicine. And so I graduated from Merrimack. I'm a certified athletic trainer. I went on to Fairfield University to get my master's degree in curriculum instruction. And during that time, I worked with student athletes, treating injuries and really practicing kind of clinical healthcare. Then I'm originally from the Boston area. I grew up in Dorchester. So I came back up to Mass after being in Connecticut, took a position at Merrimack College as an athletic trainer, then realized that I wanted to pursue higher education faculty role. And so went back to Boston University and got my doctorate in curriculum and teaching there. And then most recently, this is sort of how I landed at Colby Sawyer. In the summer of 2019, I was at Harvard's Graduate School of Education doing a management development program for higher education leadership. And Sue Stubner, the president of Colby Sawyer, who's an alum of Dartmouth, but also Harvard, was giving a talk about Colby Sawyer. And I learned about Colby Sawyer, and I heard about the pivot to shift in health sciences, and that they would be looking for a new dean to lead this. And so after that meeting, I went up and introduced myself to Sue, and the rest is history. I applied for the job and came to Colby Sawyer and Dartmouth Hitchcock in January of 2020. So as Tom said, my background is really in clinical practice as a sports medicine athletic trainer, but then shifted my career to really become a faculty member and do more research. And some of my research is focused on, in the bottom right picture there, looking at physical activity promotion with kids and how to get our adolescents and young kids more physically active, and what I was interested in, it was not only get them more active, but how it affected their learning and their cognition, and particularly science learning. And so I did a lot of work on it and developed a program called Active Science, which was the intersection of getting kids running around and being active. And then after they were active, they would go and they'd wear a heart rate monitor, and then we'd bring them through a mobile app, which taught them science by looking at their data and looking at graphs. So that's how the idea of active science was born. And so I spent a good part of my career at Merrimack doing a lot of research in that area. And then, as often happens in higher ed, you get pulled into administration, and I did that and became a department chair, and then an associate dean in the latter part of my career at Merrimack. And did a lot of work in program development. When I was at Merrimack, we had 3 undergraduate programs and about 150 students. And Merrimack, like a lot of schools in New England, was declining enrollment and really needed to change and shift. And so in about 2011, we hired a new president who came from Northeastern University and really refocused Merrimack College to grow enrollment. And so in health sciences was a big part of that. So when I left Merrimack in 2019 or 2020, we were a school. We had over 800 students, 12 programs, 7 undergrad, 5 graduate programs, about 25 faculty. So we did a lot of growth in a 10, 12 year period. So when Colby Sawyer opportunity came around, I thought a lot about the things I did at Merrimack, and I thought it was a great opportunity to grow programs and work with clinical partners like Dartmouth Hitchcock. So that's a little bit of my background. And then I really wanted to, as Tom alluded to, and I'm sure a lot of you folks are aware, in 2019, Colby Sawyer and Dartmouth Hitchcock started to get into a conversation around an enhanced partnership. And as Tom said, the partnership between the two institutions has been around for 40 years. I mean, our nursing students at Colby Sawyer have been doing clinical rotations at Dartmouth Hitchcock since 1980. So the idea of the partnership was really more around workforce development needs. And so this preceded me. I was not at the table when these conversations were happening, but Sue Reeves and Sue Stubner and many leaders at Colby Sawyer and Dartmouth Hitchcock got together and said, what are some of the professions that we cannot fill? We cannot recruit people to come to work at Dartmouth Hitchcock. And does Colby Sawyer have an opportunity to develop programs that can feed that workforce development? So that was sort of the background of the discussion. In Colby Sawyer, as you may know, like a lot of private schools, enrollment is really important, and picking programs that can grow enrollment is really a big part of that. So nursing and health sciences was a shift in the strategic vision of Colby Sawyer, and in 2020, an enhanced partnership was solidified, and we have a 5-year agreement between Colby Sawyer and Dartmouth Hitchcock Health, where Dartmouth Hitchcock is providing financial resources, $3.25 million to Colby Sawyer over a 5-year period to really jumpstart hiring of faculty, purchasing equipment to really feed these new programs. So I joined the college in Dartmouth-Hitchcock in February of 2020. And over the past 10, 11 months now, we rolled out a lot of programs, and I'll go through some slides here on what we've done to kind of get students enrolled in those programs. And so it's been a fun ride and a fun challenge. So one of the big parts of the expansion was growing existing programs. So as many of you know, Dartmouth-Hitchcock has a huge need for nurses. And so part of the partnership is over the next 5 years, Colby-Sawyer is going to bring in 15 new freshman nursing students into our program per year. And at the same time, the idea would be to graduate more nurses. And hopefully those nurses will stay and work in the Dartmouth-Hitchcock or the New Hampshire or region. So that's part of it, is growing our current undergraduate nursing program. That's part of the partnership. The other pieces are growing what we call our RN to BS program. So we have a lot of associate degree nurses that are working in healthcare, and the profession of nursing would love them to go back and get a bachelor's in nursing. So around 2016, Sue Reeves and the faculty at Colby-Sawyer started an RN to BS program. So this is for nurses who have their associate's degree to come back and get their bachelor's in nursing. And so part of the partnership was to grow that program as well. And that's a fully online program. The second part of the partnership was to develop new programs. And so what we've done is we've added a respiratory therapy program. So one of the key areas of workforce need in Dartmouth-Hitchcock in the region is more respiratory therapists. And this is pre-COVID. So with COVID, obviously, there's even a greater need. So what we developed was a same idea as the RN to BS. It's a bachelor completion program. So respiratory therapy, respiratory care functions very much. A lot of programs are associate degree prepared. And so Colby-Sawyer now has a bachelor completion program. So if an respiratory therapist wants to come back and get their bachelor's degree, Colby-Sawyer can be a destination for them to do that. And that's a new program we just launched this fall. We also added 2 new tracks to our master's in nursing program. So in 2017, Colby-Sawyer launched a Master of Science in Nursing with 1 track. It was called the Clinical Nurse Leader track. And what we realized by looking at the market, there was a stronger need for more nurses who are bachelor prepared, that they wanted to get a master's degree. And so we rolled out 2 more tracks in our nursing program. One's called Nursing Education, and the other one's called Management and Executive Leadership. So those also launched this fall. And then we developed what we call an associate's degree in health science. And this is a really unique program to Dartmouth-Hitchcock. So Dartmouth-Hitchcock has in 2014, they developed what they call a Workforce Readiness Institute. And what that is it trains a lot of our entry-level professions, such as medical assistants, pharmacy technicians, surgical technologists, licensed nursing assistants. So a lot of entry-level positions, they couldn't find people for them. So in 2014, they created their own kind of institute to train those folks. And so what we did is partner with them. Is folks will go through that training program, and then we give them Colby-Sawyer credit for those courses. And then they can, by taking 5 liberal education courses at the end of that program, they can get their associate's degree in health science from Colby-Sawyer. So prior to that, they would go through a program and they wouldn't have a degree from an institution, because Dartmouth-Hitchcock is not a degree granting institution. So the partnership with Colby-Sawyer has allowed students to graduate from those apprenticeship programs now with a degree, which is exciting. And in the bottom of the slide, there shows some other new undergrad programs that Colby-Sawyer has launched this fall, based on workforce development needs. So a Bachelor of Science in Social Work, a Bachelor of Science in Addiction Studies, a Bachelor of Science in Medical Laboratory Science, a BS in Healthcare Administration, and then a general BS in Health Science. So as you can see, lots of program development and growth has happened. And so in the school that I oversee, in the School of Nursing and Health Sciences, this slide just shows you the programs that are in my school that are part of this partnership. And like I said, we have a BS in nursing and exercise science and public health and health science, and then in respiratory therapy. And then we have a suite of graduate programs as well. So a little bit more about our School of Nursing and Health Sciences. We have 15 full-time faculty that are in the school. So these are folks who are full-time teaching, doing research, advising our students. We have 2 professional staff that work with us around kind of administrative responsibilities. And then we have a whole host of really important people that oftentimes most of them are Dartmouth-Hitchcock employees. Either they're nurses or other leaders where their full-time job is at DH, but they teach kind of part-time with us. So those are our adjunct and clinical faculty. So they're a really important part of our faculty at Colby Sawyer. And then the facilities, and if people have been on campus at Colby Sawyer, we have some dedicated spaces for our nursing and health science program. We have some labs, 2 labs. One is in Mercer and one is in Colgate, that is equipped to teach students hands-on activity. And then we utilize up at Lebanon, we use what we call the Patient Training Safety Center, which is where students learn simulation. So they practice their skills in a simulation center that DHMC has on site. So our nursing students go there and they learn how to treat injuries, how to do skills in a practice environment. Then when they get on the clinical floors, they have hopefully have seen some of those things prior to. So we also use DHMC's simulation lab. So when I came to Colby Sawyer, one of the things that we needed to do is to grow our enrollment. And so what this slide shows you is, if you look at the bottom, those are our undergraduate programs: nursing, exercise science, public health, athletic training, health science. And so when I came in January, you can see that in the blue bar, that's where our undergraduate enrollment was. And then this fall, where we've grown. And so I guess the biggest story here is nursing's. We had 98 incoming freshman nursing students this year. It's the largest class ever in Colby Sawyer's history, which is great. And so we can see that we're trending in a positive way around nursing undergraduate enrollment. So we have about 344 students currently in our undergraduate program in nursing and health sciences. And this shows you what's the total. So we have some other programs, which I call professional learners. So the RN to BS, those are nurses that are coming back to school. We have the associate degree program, the MSN program. So when you combine our undergraduate plus we call our professional learners, or our graduate and bachelor completion programs, what that tallies up to is kind of 432 students currently in our School of Nursing and Health Sciences, from 320 last spring. So we're seeing a lot of positive movement in enrollment, which is great for Colby Sawyer, because this is where we need to move and grow. And the idea at Dartmouth-Hitchcock is that a lot of these folks, for example, the MSN population, because of the reimbursement that Dartmouth-Hitchcock provides to employees, it's a way to retain them, right? So if I'm a nurse and I'm working at Dartmouth-Hitchcock, I can go back to school. I get $3,000 a year. Colby Sawyer has a partnership with Dartmouth-Hitchcock. So if you're a Dartmouth-Hitchcock employee, your tuition, we discount it, and we give scholarships to DH employees to come back. So it's a way to incentivize folks to come back to school, but make it affordable to them. So that's also part of the partnership that we have between Dartmouth-Hitchcock and Colby Sawyer. And this is a little bit of a slide of what enrollment looked like this year. So we had 20 students enroll in our associate degree program, which is awesome. Our freshmen, we had 98 enroll, which our goal was 80. We have 58 sophomores, 35 juniors, and 41 seniors in our undergraduate program. Our RN to BS programs up to 40. When I got here in February, we had 14 students there. So we've done some really healthy growth in enrollment, which is exciting. And like I said, a majority of the professional learners, 75 to 80% of them are Dartmouth Hitchcock employees. So that means that a lot of folks are coming back to Colby-Sora for our programs, are coming from the New Hampshire region. And so a couple more slides and we can kind of talk and have some questions, is kind of what's the next phase of where we're going. And we're developing right now what we call an accelerated Bachelor of Science in Nursing. So what that is, that's a degree for students, for folks who already have a Bachelor of Science or BS in something else. So for example, I've got a BS in business and I want to become a nurse. How do I do that? We can take you through an accelerated BS program in 16 months, and you can come back to Colby-Sora and get your Bachelor of Science in Nursing. And basically what that means is it's solely focused around nursing courses. So because they have another degree, they already have all of their other prerequisites already satisfied. So that's coming on in the fall. We also have an online BS in Health Science degree that's coming online. So this is for oftentimes Dartmouth Hitchcock employees, they can't come to campus to take courses. So we're really trying to, at Colby-Sora, broaden our online offerings for them. So that's going to be coming down the pipe. We've talked about other areas of growth, maybe nurse practitioner or a doctorate of nursing practice. We've talked about exercise science and strength and conditioning as opportunities in the performance side. We've talked about physical therapy maybe as an opportunity at Colby-Sora for a new program. So we're in conversations with kind of Dartmouth Hitchcock leadership around what are the needs, like what areas of need do they have, and what at Colby-Sora can we develop for more program to help the workforce. And lastly here, one of the things that's come about is because of the partnership is really, the area that I oversee is nursing and health sciences, but we've got a whole host of other students in business, in psychology, in graphic design, and finance, marketing, that Dartmouth Hitchcock Health needs those employees too. And so I've focused a lot today about nursing and health sciences, but we're doing a lot of work to work with students at Colby-Sora for career opportunities in all sorts of areas that DH needs. And so this fall, for example, we had folks come down virtually, do a Zoom kind of career panel for our first year experience courses. So these are our freshmen that are in their first year, to really let them know that there's careers in healthcare, but that are non-clinical. So you don't have to be a physician or a nurse to work in healthcare. You can work on the social work side. You can work in the finance side. You can work in the administrative side. And so we invited folks to talk about their careers to Colby-Sora students. So I think this slide is showing you that we're thinking about the partnership broadly, and not just around nursing and health sciences, but how can Colby-Sora students, get internships at DH across the board. So I will stop there.
Great presentation, very interesting. I would imagine that one of the challenges at growing so rapidly is quality, maintaining the quality of your incoming students, the quality of your programs, stressing faculty. What are your greatest challenges from a quality standpoint, and how confident are you that your future graduates are going to be of comparable quality to your past graduates?
Yeah, that's a great question. And the nursing faculty always bring me back to that point.
I can vouch for that.
And so Joan Loftus is our director and chair of nursing, and she's been at Colby-Sora for 13 years, was part of when Sue Reeves's time, when the program was struggling, and all the hard work that faculty in the college did. So there are some metrics, David, along the way. So as we bring in that 98, that freshman class, already from from fall to spring, we've lost students, and that's okay. They have to still maintain, a B- or better in anatomy and physiology and microbiology, and they have to get a certain, in their nursing courses, they have to get 80% or better. So the policies that the faculty created to change the program years ago to make it a high quality program are still in place. And so my hope is that as we attract more students, we attract higher quality students that will be able to maintain and retain in the program. But those metrics around quality for nursing in particular, because we know when they get to that NCLEX exam their senior year, we want to maintain that 98, 99, 100% pass rate. And so as we grow, what we're trying to do, David, is we're trying to put some measures in to help those students who could do a bit more around study skills, right? So they come in, we instituted a freshman nursing 0 credit seminar course to help some of our nursing students around how to study for microbiology, how can you prepare more. So just some of those factors that might help students, get over the hump, but by no means are we going to graduate the 98 that came in through the program. And so the faculty, I guess, in short, they're going to keep and maintain the quality. But my job is also to say, what other things can we do to help students along the way that may be good candidates to become nurses, but may not come with some of the best skills. So I hope that answers your question around kind of maintaining quality.
Yeah, that's
I might answer a little bit too, David, having been involved with Colby Sawyer for almost 20 years now. The quality of the students, particularly for the nursing program, has gone up with the reputation, and the association with DH certainly helps that. Kevin hasn't been around as long as I am, but you can see in the quality of the students that we're attracting has gone up.
And the other thing I think, David, you brought up about how do you, as you grow, what are some of the challenges that I see? Part of the challenges is as part of the enhanced partnership, obviously there's a financial investment from DH, and a lot of that initially we've been able to hire more nursing faculty, which has been outstanding. And we've been great so far. Since I've been here, we've hired 3 faculty. We've got 2 open searches right now for next fall. So the college, because of the partnership, has been able to invest in hiring faculty so we can continue to support the growth. One of the things, I guess no different than Dartmouth Hitchcock and other institutions in the area, is recruiting the talent to come to Colby Sawyer. And particularly in nursing, it's a real challenge to get folks into nursing education because they can make a really good career at the bedside and financially be paid well. And so a lot of college universities struggle to hire nursing faculty for some of those reasons. So I'd say that's one of my things that I think about is, as we grow, it's not that the college isn't going to support us to get the folks, but I got to make sure we attract them to come to Colby Sawyer.
Great, that's a great answer. As a son of an academic physician and a healthcare administrator for more than 30 years, what you're doing is extremely important, and it's a great service to the country and to the region, because we need more nurses and other healthcare professionals. It's a area that's, with our demographics, is only going to require more people, and so a quality program like yours is a great asset to the region.
Carol, go ahead.
Very interesting, and I'm impressed with how much the scope of the program has grown over the years. But one thing I wondered about is what kind of financial assistance is provided to the students that are there? I mean, I heard, if you're an employee of Dartmouth Hitchcock, you get some help and support and so forth. But what about people who come from outside of DH? What kinds of incentives are offered to them to study at Colby Sawyer?
Yeah, it's a great question, Carol. So we definitely have the partnership with Dartmouth Hitchcock, and that's a a percentage of tuition that we discount for those employees. But what I've realized is, what about for some of our programs? I've worked now with the 7 community colleges in New Hampshire. So I just got off the phone with Great Bay Community College and trying to get a partnership with those folks who graduate associate degree nurses from their program. How can we have them attracted to Colby Sawyer to come back for their RN to BS? So we have a tuition discount. We're working through the community college system of New Hampshire. So if you graduate with an associate's degree from one of the community colleges, that you can, for a discounted rate, come back and complete your RN to BS degree with Colby Sawyer. And we're also, we just had a conversation with Lake Sunapee VNA to do some work around tuition, an agreement with them. And so oftentimes, what I'm doing a lot of work on is reaching out to organizations outside the DH network and seeing if they want to partner with Colby Sawyer to, if they want to send their employees to get their degree, if it's a master's degree or a bachelor's degree, that Colby Sawyer can have a relationship with them, that we can offer their employees a discounted rate to come back. So we are expanding the model outside of the DH network. And then at the, I guess, the undergrad students, a different population, the 18 to 22-year-old, they've got financial aid, and there's a whole system around kind of that process. But I'm talking with the folks who we call professional learners. So they're coming back for their bachelor completion degree or their master's degree, and they've got a family, and how can Colby Sawyer be affordable for those folks?
One more thing, I want to compliment you on developing the Addiction Services Program. I'm on the board of Headrest, which you're probably familiar with that organization, and it's a tremendous need for qualified people to provide services. I mean, oftentimes that's the problem. There just aren't enough folks to work with the population that's out there. So I was very gratified to see that. And
so I think that was, once again, those were programs, I think the BS in addiction studies and the BS in social work, in those social service areas, I think are going to be a real need. And I think we're also just at the master's level having some conversation around a master's of social work too, or what could that look like at the graduate level for folks who might already have their bachelor's degree? So, yeah, I agree.
Kevin, thank you very much. That was a great presentation. Really appreciate your time.
Well, thanks, folks. Thanks for having me, and I look forward to maybe meeting other folks in the future. So, thanks, Tom, for the invite.
You're welcome.
All right.